In the session in the mid-morning, I think we are aware and we heard about how countries, especially low-income and middle-income countries, are facing increasing challenges in choosing and selecting healthy diets, while the focus is mostly based on the supply side of food. But our session today is bringing in another side, which is the demand side. So we have a total of 5 speakers. 4 are here in person and 1 is online. So from our speakers, we are going to hear about the evidence. We are going to hear about the evidence, what factors influence choosing healthy diets, perceptions, and behaviors. So my name is Hadija Mbwana from Sokoine University of Agriculture, and we are going to allow our speakers 10 minutes for presentation, and then at the end we are going to have a Q&A session around 25 to 35 minutes. So we start with our first presenter, who is Agustin Miranda. Agustin Miranda is a postdoctoral researcher from the French National Research Institute for Sustainable Development. And Agustin today is presenting about exploring capabilities, opportunities, and motivations influencing dietary behaviors in Vietnamese adolescents. And he's telling us about preliminary findings and possible implications for future interventions. Miranda, welcome on stage. You have 10 minutes.
Hello, everyone. And today I'm pleased to present these preliminary findings from this research on the factors influencing the dietary behaviors of adolescents in Vietnam. This research is part of the SHIFT initiative in Vietnam. As you know, adolescence is a critical period in life where the physical, mental, and social development is important. And the habits, dietary habits, and all the health habits and behaviors are developed during this stage and have long-lasting effects. In Vietnam, currently live 14 million of adolescents that are especially vulnerable to the ongoing nutrition transition. Their diets are characterized by high consumption of ultra-processed foods, nutrient-poor foods, and energy-dense foods. As a result, multiple forms of malnutrition coexist. The results from the last national surveys report, for example, a prevalence of 7% of thinnness, 14% of stunting, 10% of anemia, and 27% of overnutrition in adolescent girls. In this context, the SHIFT initiative is working in analyzing and understanding the consumer's behaviors and the impacts of the food environment. Our research, this specific study, aims to study the factors that influence the dietary behaviors in the adolescents from Vietnam using the CONV model. The CONV model is a well-known framework in behavioral research, and that stands for capability, opportunity, motivation, and behavior, and is used to understand the factors influencing the behavior and design the interventions. Capability refers to the different physical and psychological capacity to engage in the behavior, for example, the knowledge. Opportunity covers external and internal factors that shapes the adherence to the behavior, for example, the food environment. And the motivation includes the mental processes, for example, belief, preferences that shapes the behavior. So we use this model to map out the different actionable drivers. For this, a cross-sectional survey was conducted from December 2022 to February 2023 in 2,861 adolescents from Vietnam, from living in low-income neighborhoods in urban and peri-urban districts from Hanoi, and also in a rural town. The data was collected with a household and individual questionnaire representing, using scales representing the different elements of the COMBI model. For example, for capability, we use the knowledge scale. For motivation, we analyze the food choice motives. And for opportunity, for example, we use the accessibility to healthy and unhealthy foods. This survey also included 24-hour recalls to calculate the food intake, the dietary intake, that was used to calculate the GDQS, the Global Dietary Quality Score. And in this research, we used the two subscores, the positive and the negative subscore, as an outcome. First, we check the reliability and the validity of each of the measures, each scale, and then we ran a structural equation modeling analysis according to the COMBI model. Let's dive into the results. First, we analyze the relationships between the different metrics, the different variables, with their corresponding domains, that is the COM. And we found that, for example, for opportunity, the variable that had the strongest weight was those related with the physical and economical access. In the case of capability, knowledge and agency, and in the case of motivation, it was food choice motives related to health, natural content, and sustainability of the diet. Then we analyze the relationship between the domains, that is the COM, and the outcome. And we found that there was a strong positive correlation between opportunity and capability. Then capability was also related with motivation. First, the relationship between opportunity and capability suggests that when adolescents are provided with supportive environments, they tend to develop they are more capable to adhere to sustainable and healthy diets. Then capability, the relationship with capability and motivation was also positive, suggesting that when they are feeling more capable, they can develop and be motivated towards healthy diets. As motivation was correlated positively with the healthy dietary behavior. However, we did not find significant correlation with the unhealthy dietary behavior. So these results lead to think in some possible interventions at the different levels. For example, at the level of capability, it's important to develop interventions for improving the nutrition education and also experiential activities at the school. Also at the opportunity level, for improving this opportunity, it's important to, on the one side, regulate the marketing exposure to unhealthy diets. At the physical food environment, for example, we have the photo over there from the school canteen that we can see the exposure of unhealthy diets in marketing, but also the digital food environment, that is very important. Also increasing the access to healthy meals in schools, like school programs, vouchers for fruits. And in the case of motivation, some promising interventions are, for example, the promotion of healthy foods to the peers, to the social networks of the adolescents that can influence positively their behaviors. And also raising awareness on the unhealthy eating behavior that is present in the social media. Summing up, the COMBI model was useful to identify the factors influencing the dietary behaviors in adolescents. However, we need to explore more what is happening with the unhealthy diets. And maybe we need to include more variables that were not taken into account in the current model, that are more complex in explaining the unhealthy dietary behaviors. And okay, intervention should enhance the capability and increase the opportunity that can lead to motivations towards healthier diets. Thank you.
Thank you very much. No, just down. Thank you very much, Agustin, for that insightful presentation on the potential of the BCOM model in identifying the determinants of dietary behaviors in adolescents. Please keep your questions, and we shall have the Q&A session at the end. So I'll immediately call our second speaker, who is Julia De Bruin. Julia is a scientist from the World Vegetable Center, and she will be presenting to us today on integrating lived-in experience research in multi-stakeholder workshops to guide food environment actions which support fruit and vegetable intake in Arusha, Tanzania. Julia, welcome. You have 10 minutes. Thank you.
Hi everyone, I'm going to be presenting some research that I led with my collaborator Jessica Gordon on food environments in Arusha region, which is where I live. So this research was part of the CG Research Initiative on Fruits and Vegetables for Sustainable Healthy Diets. The work presented today was led by the World Vegetable Center together with the Institute of Development Studies, but the broader initiative has been led by IFPRI. We have a lot of international partners as well as key national partners within Tanzania. So the Fresh Initiative is based around this idea of an end-to-end approach, which is our approach to increase fruit and vegetable intake. And the idea is that in order to achieve change within the food system, we need to be identifying the multiple barriers that exist across that system and then pursuing multiple coordinated actions to address those barriers. So the work I'm focused on today is specifically within the food environment component of the food system. And our aim has been to build a detailed understanding about what drives and what enables fruit and vegetable sale, acquisition and consumption, and then work with local stakeholders to guide the design of targeted interventions. So today I'd like to talk about some research findings, but I'd also like to present our research process. So obviously in the design of any intervention, it's really crucial to think about the needs and priorities of different stakeholder groups. In this research, we focused on a diverse group of policy, research, NGO and private sector stakeholders, as well as fruit and vegetable vendors and consumers within the same region of Tanzania. So we've had a sequence of research activities involving these various groups. We began with a quantitative assessment of the food environment. This was led by my collaborator, Quinn Marshall from IFPRI. We held a first stakeholder workshop with our policy research NGO private sector group in March of last year to share some of those initial findings and to start having small group discussions about challenges and opportunities that people would like to present. This led into a lived experience research activity, which integrated vendor and consumer perspectives. And this is mostly what I'll focus on today. And then at the end of last year, we brought those 3 stakeholder groups together to share and reflect on research findings and form some joint recommendations. So the quantitative assessment of the food environment helped us to build an understanding about the retail food environment across 33 studies participating in a larger randomized controlled trial within Fresh. And for this research, it helped us to identify 2 contrasting sites in which to conduct this lived experience research. So on the left there, we have Shiboro, a relatively rural location. We can see from the satellite image. Those yellow spots are showing the location of food retail outlets, so quite few in Shiboro, limited market access, poor quality roads. And on the right, we have Kiwawa, which is a more urbanized location, much higher density of households, also of retail outlets. And we can see it's along a main road, so easier access to markets. We began our qualitative research with 41 in-depth interviews with consumers and vendors using a question guide that was based around the food environment framework by Turner et al. And so our aim was to understand people's everyday experiences, practices, and interactions within food environments with a focus on how that drove their fruit and vegetable sale or consumption. And we tried to have quite a diverse sample. So for our vendors, we worked with vendors of differing types, from mobile vendors to market stalls, street stalls, also farmers selling direct to customers. And for both vendors and consumers, we also made sure to include those with heightened vulnerability, so single parent households, low income households, those living in remote areas. About half of our interviewees progressed to a second research activity, participatory photography, using the photo voice method. And this was another way for people to share images and stories of their experiences and what mattered to them within their food environment. So we held a first workshop to introduce the activity, to practice taking photos and talking about photos, and to provide a set of prompts to guide the photo taking activity. We had a 2-week period where people took photos as they went about their everyday activities, and then a second workshop where everyone came back together. They shared photos through a small exhibition, had small group discussions around their photos, and then came up with joint reflections. And just to highlight a couple of key follow-up visits within that time were really crucial. Firstly, just to check that people had understood the task and weren't having any technical troubles. And then secondly, to help people select their most significant images and prepare captions for those. So I won't speak to the next 2 slides, but just to mention that our approach to analysis was we used thematic analysis. So we worked on the interview transcripts, the workshop notes, and the photo voice captions. And so we came up with a set of codes and subcodes around the external food environment as well as the personal food environment. But what I wanted to focus on is just 5 key themes that emerged from this analysis. So the images and the quotes that you'll see on the next few slides are from our photo voice work. The first is around food safety concerns and responses. These emerge really strongly amongst both vendors and consumers, particularly about the use of chemical pesticides and often in relation to leafy green vegetables. So in some cases, this was enough to deter people from buying and eating vegetables, like this photo voice participant has shared. In other cases, people really emphasise the importance of trusted relationships along the value chain, as well as own production in cases where that was possible. We also identified a theme around infrastructure and product-related challenges. So fruit and vegetables are obviously highly perishable, and so issues around deteriorating quality where transport and storage was not ideal came up a lot across diverse food retail outlets. So common concerns around lack of a cold chain, poor quality roads, poor market infrastructure, lack of access to water and sanitation facilities. And at a village level, for stalls that are located within relatively remote communities, vendors shared that this was discouraging them from diversifying their product range. If they weren't sure whether items would sell, they were uncertain about demand, and they had this worry about perishability, it would put them at financial risk to be diversifying their products. Another theme was around kind of the availability and access, set of considerations. Seasonality was mostly mentioned in relation to fruit, with variation in both supply and quality across the year. Most households were procuring produce from a range of outlets, so maybe once a week travelling to a central market, particularly for fruit purchases, and then on a daily basis buying vegetables close to home. And issues around transport were very widely spoken about, both in terms of the convenience of travel, potentially having to take multiple modes of transport, or the cost that was associated with that travel to a central market. Financial barriers were also raised by both vendors and consumers. Markets offer lower prices for many items, but this can be offset by transport costs. We heard this morning about the transaction cost idea, and obviously in food procurement, this is a consideration. From a vendor perspective, people spoke about lack of access to capital as a barrier to widening their product range and improving their infrastructure. And for consumers, people spoke about their coping strategies, maybe buying a slice of watermelon instead of a whole watermelon, or just buying the lower cost fruit that was more accessible, or in some cases, like this quite striking image, just going without vegetables at all. Our last theme is around familiarity and cultural norms, and this was more something that was kind of observed behaviour rather than directly stated. But we observe the food plate to be relatively consistent, leafy vegetables appearing as a cooked side dish, usually prepared in a pretty consistent way. There were certain items that were associated with, this perception of being for urban markets or for international residents, not for consuming at home, and snacking being an uncommon practice. And just a few examples, like this lady here speaking about the specific cultural significance of particular foods. So to jump back to our workshops, we co-hosted these with an existing platform, the Arusha Sustainable Food Systems platform, which we expanded with the inclusion of a wider variety of local government actors. And in our second workshop, we also invited along research participants to bring their direct experiences and contribute to that design process. So the ideas that have emerged from this process have been taken forward by our research team to create a prototype intervention, which we're currently in the process of refining through a human-centered design workshop with GAIN and IFPRI. So I just wanted to conclude by, putting a strong case forward for the importance of inclusive research and intervention design processes. I think if we want our actions to be equitable, sustainable, and impactful, this is really crucial. The model that we've used here in Tanzania, we've also used in Sri Lanka and the Philippines. And it's really been about trying to bring these different perspectives together, build connections, and have this multiple point of engagement with people. So I'll finish there, but just wanted to highlight that one of our key outputs has been a story map, an ArcGIS story map, which is an online way of sharing information. So we've got a couple of reports available online, but I'd also really invite people to have a look at this story map, which includes maps and images and stories, and we have a manuscript in the pipeline. Thanks very much.
Thank you very much, Julia, for that insightful presentation, and we are looking forward to your further analysis that you said that will enable us to understand how to integrate multiple needs and priorities across a diverse set of stakeholders. Thank you very much. So I will call our third speaker, who is Kim Marsen. Kim is a postdoc at Wageningen University, and Kim is going to speak about identification, characterization, and determinants of dietary diversity patterns of adolescents in rural and peri-urban and urban Vietnam. Welcome, Kim, on stage. You have 10 minutes.
Yes, thank you very much for the introduction. And it's my pleasure to present to you today the results of a study that were also conducted in Vietnam under the CG initiative, Sustainable Healthy Diets Through Food Systems Transformation. So the same data set that Augustin presented on earlier in this session. And in my work, I look at identification and determinants of dietary patterns of the adolescents in rural, peri-urban, and urban Vietnam. As Augustin already presented, and you'll know here in the room, suboptimal diets are a leading cause of adverse health outcomes globally. And adolescence is a sensitive time period, not only because of the higher nutritional needs that adolescents have for growth and development, but also because it's in transition time that affects opportunities, roles, and responsibilities in food choice, and establishing healthy habits in this time period, that can affect healthy choices in the rest of their life. So it's considered as the second window of opportunity for nutritional interventions. And if we want to have successful nutritional interventions, it's important to understand what consumers are eating and not only look at specific nutrients or foods, because they're not eaten in isolation alone, but to really understand the dietary patterns that are consumed by individuals and the socio-demographic factors that influence these patterns, because this can help us to design tailored nutritional interventions. And therefore, in this study, the objectives were to first identify dietary patterns of adolescents in Vietnam, second, to examine the healthiness and the nutrient adequacy of each identified dietary pattern, and third, to determine the socio-demographic characteristics of adolescents in each identified dietary pattern. We did this, as Augustin already presented, with cross-section collected from almost 3,000 adolescents between the ages of 11 and 19, living in low and middle income communes in a rural town, peri-urban and urban districts in northern Vietnam. And for the methods, first we assessed dietary intake using a multiple pass quantitative 24-hour recall. And then we combined all of the food items in this recall into 17 food groups that was based on the global dietary quality score, but that was adapted to the Vietnamese eating context. By combining several food groups that were not consumed often and splitting, for example, rice and noodles, because these are really eaten in different occasions. And for each of these 17 food groups, we then calculated the total intake in grams per day for each of the individuals. And then we identified the dietary patterns using a data-driven method to identify them, so without any prior hypothesis. And specifically, the method latent class analysis was used, which has the advantage that it groups people into mutually exclusive groups that are all have similar dietary patterns within one group and as different as possible dietary patterns between these groups. And it does that based on the observed variables that you put in the model. And in this case, that was the intake of each food group per day, and thereby the clustering is your dietary pattern. And to handle the skewness of the intake of food groups that is common in nutrition research, we categorize the intake of each food groups into 3 categories: non-consumers, consumers with an intake below the median, and an intake above the median. And all of the analysis were adjusted for energy intake to look at the proportionality of these food groups more so than differences in energy intake. And these analyses were conducted in a software that can be used for this, which is Latent Gold. And here's a small illustration about latent class analysis, because not all of you might be familiar with this. So basically what it does, you start with your study population, and your observed variables that you put in the model are the intake of the food groups. And then based on these observed variables, it looks for unobserved or latent clusters of people, and it categorizes people into a cluster. Within a cluster, they have minimized variance between the food group intake. And then as a researcher, you can look into the probability of consuming each food group in each subgroup. And then you can label, based on that, you label or name the subgroups or the dietary patterns. So for example, if there's a high intake of animal sourced food, you can name it animal sourced food. And subsequently, you can then look at the associations with healthiness of these dietary patterns that you identified and socio-demographic characteristics of the individuals. And to assess the healthiness of diets in this study, we used the global diet quality score that Augustine presented with the subgroups, the GDQS healthy and the GDQS unhealthy. And nutrient adequacy was assessed as the mean probability of adequacy of 11 micronutrients. Then on to the results. Here you can see all of the food groups, and a 1 identifies high intake of a food group and 0 is the lowest intake. And we identified 5 dietary patterns, of which the first one we named the diverse dietary patterns because it had a diverse range of food groups that are labeled here in green. So high intake of, for example, dark green leafy vegetables, dairy, eggs, and fish. The second dietary pattern that we identified was called the least diverse dietary patterns, with low intakes of all food groups apart from rice and poultry. The third dietary pattern that we identified was labeled unhealthy foods because it was characterized by higher intakes of unhealthy foods such as sweet and sugar-sweetened beverages and juice. The fourth dietary pattern that we identified was labeled the bread and meat dietary pattern because it had high intakes of those food groups. And the fifth dietary pattern that we identified, we labeled average because it wasn't really outstanding in any of the food groups, but just at average intakes overall. And then when we looked at the healthiness of each of these identified dietary patterns, we saw that the diverse dietary pattern had the highest intake of healthy foods, lowest intake of unhealthy foods, and the highest nutrient adequacy, as you can see in this table. the least diverse dietary pattern had the lowest intakes of healthy foods, a modest intake of unhealthy foods, and the lowest nutrient adequacy. And the unhealthy foods dietary pattern had the highest intakes of unhealthy foods, although in this study population intake was relatively low. So yeah, it was higher than the other patterns, but not very high overall. So that's important to keep in mind. And then when we looked at the socio-demographic characteristics of adolescents in each dietary pattern, we saw that the diverse pattern was characterized by adolescents mostly from peri-urban and urban areas, coming from higher wealth tertiles and had high food security. Adolescents from the least diverse pattern were mostly from the rural town, lowest wealth tertile, and low food security environments. And individuals from the unhealthy food patterns were mostly girls from the urban area. So to conclude, we identified 5 dietary patterns, and the most diverse identified dietary patterns was the healthiest and most nutrient adequate. Adolescents in food insecure, low wealth household in rural Vietnam may be most vulnerable to nutrient inadequacies. And it was mainly characterized by a low intake of healthy foods, more so than a high intake of unhealthy foods. And thus efforts to increase the consumption of healthy foods for these groups are urgently needed. And in this study, adolescent girls in urban Vietnam consumed a dietary pattern with unhealthy foods. And this was a novel finding from this study, so needs to be confirmed or replicated in other studies to see if they find the same. And it requires a better understanding of drivers to inform targeted and age-appropriate interventions. Thank you very much for your attention.
Thank you very much, Kim. So for those results that call upon efforts to increase the consumption of healthy foods among this very important group, the adolescents. So I'll go ahead to call our fourth speaker. Our fourth speaker is Francis Odu. Francis is a doctoral fellow at the Alliance of Biodiversity International, and Francis will present about co-created nutrition-sensitive interventions to enhance dietary diversity and promote spillover effects in communities affected by extreme drought in Turkana, Kenya. Welcome, Francis. You have 10 minutes.
So good afternoon, everyone. Today, I am very delighted to share the work that we have been doing at the Alliance of Biodiversity International, SIAT. And this work stems from what we have carried out over the years since the year of 2016 in these dry land areas. So I would like to give some brief background into this work and say that we all are aware that climate change crisis is really affecting people. And we are told that from research that by the year 2050, maybe our food production will reduce by almost 30%. And this is going to be even worse in other areas than in some places. And already in the Horn of Africa, where our study area is located, already 60 million people are classified to be suffering from severe food insecurity. And more than 11 million children already suffering from high acute malnutrition in this area. And our study area, Turkana County, sits right at the center of this crisis. And it's an arid area where food insecurity is very rampant. And this is worsening over, and this has also been has been heightened by the crisis like COVID-19 that also disrupted some of the supply chains there. And what we thought of is that to come up with a solution, and we thought of co-creating solutions together with these communities. And so communities can then be seen as also contributing and not just as mere beneficiaries in projects, that they can also contribute their expertise, that they can also be seen to have solutions for their own problems. But then, despite this kind of significant appraisals, we see that in this kind of environment, co-creation efforts are usually very limited. And most of the time, programs are already top down, coming from the donors, coming from the programmers, and then just informing them what needs to be done. And many issues contribute, of course, to this. One of them is maybe the high low literacy level that is characterized as this kind of environment, and also the difficulties in this environment, including the distances that people have to travel to maybe take part in these co-creation events. So in this study, we had two main objectives. And one of the things was we wanted to investigate is to see how programs can be modeled together with the community so that we can enhance resilience. And in this resilience, we also wanted to ensure that these programs that are designed and interventions that are designed can also remain sustainable in this area. And finally, the second objective of this study was also to examine or to evaluate the impact of these interventions that are co-created with the community, especially in relation to how they impact dietary diversity as a measure of resilience in the communities. So initially, we had set up to hypothesized that this would then result in 15% increase in dietary diversity, especially amongst the intervention community compared to the comparison community. But then droughts occurred, and a lot of time, more than 5 seasons of rain failed. And so it created a natural experiment that we then thought of examining. So in this case, we then thought of changing the hypothesis to say that we wanted to now check whether these co-created interventions can be able to buffer communities against the extreme impact of this climate change. And so to do this, we have approached this in a kind of participatory manner and created a control trial with 17 communities that have been identified, and 7 of them being taken to allocated to comparison group where we did not do any interventions, and keeping 10 of them for intervention where we had these co-creation sessions with them. And then at the beginning of the study, we implemented a baseline survey where we had 360 households getting involved. And then later, after we had initiated the experiment and right in the middle of the extreme drought, we expanded these communities and now involved 600 households. This was done exactly 6 months after we already stopped the supervised intervention phase. And so the co-creation process that took place in these 6 intervention communities were composed of 6 community workshops or workshop sessions that started with the introduction to the development or to sharing of basic nutrition information, and then to co-creating the solutions together with the community, and then finally coming up with community action plans. Then to just sum it up, we ended up with an MOU with the community, which spelled out what the community had to do, and then what from our end we also had to facilitate. So what we ended up with is that community selected and prioritized what they preferred most and what they thought that would be best solutions for their issues. And this included kitchen gardening in all the 10 communities, village savings and learning in 3 of the communities, and then poultry rearing in 2 of the communities. And then to all the communities also implemented some nutrition education to back it up. So to also facilitate this, we set up some demonstration garden at the center of each of the 10 communities where people would then learn, and then we supported this with some technical trainings from the county government officers. So to facilitate measurements, we collected data on data diversity score and assessed this based on 7 food groups for children and 10 food groups for women. And then we did a DID analysis and also extended this to spatial analysis to see how these impacts may be spread across the study area. So some exciting results that we achieved. We see a clear gradient that communities that have participated in these interventions had more adoption compared to those that did not participate. For example, we see that close to 91% of those people who participated also ended up setting up kitchen gardens. and this graduated low for those people who are indirect beneficiaries. Those indirect beneficiaries means that these are people who are not directly involved in the project, but then live within the project areas. So we have, for example, about 44% of them that participated and about 35% implementing these interventions. But then what is more exciting is that we see that overall, because of the drought, there was a decline in data diversity across all the three comparison groups. But then even though we start at almost the same level for all the groups, we see that those people outside the intervention areas had a clear decline in their data diversity scores compared to those that remained within the project areas, the intervention areas. And then to see this, we even investigated the spillover effect and saw that there was clearly a buffering effect of the intervention, with communities that are directly involved even having higher impact than those that were not involved in the project. So we also see that distance matters a lot, that for every 2 kilometers, 1 kilometer that you walk away from the demonstration garden, the data diversity decreased by 0.2. And then this was effective up to 10 kilometers, beyond which then their impact was remarkably not visible. So what we see that from this, what we can take away is that we see that when we work with the communities and recognize them as also people who are knowledge holders, then you can easily co-create interventions that can maintain data diversity even against this climate crisis and against any other climate crisis that we can see. That also we see that when we are co-creating these programs and when we are creating interventions, we need to have a clear mind of the impact that we want to create. And the most important thing is that we need to also create these programs with the mindset that we want to have the spillover effects beyond just the intervention people or beyond the intervention communities, so that we can be able to see this impact getting wide and spread across the entire community. We also see that it is important also to be very strategic, that we must work with the mindset that the intervention can only happen across certain limits. And for our study, we see that this was within the 10-kilometer radius of the intervention area. And so to enhance this, you need to also work within the already existing structures. Like in our case, we adopted the use of community health promoters, who are very useful in enhancing these program efforts across the communities. So thank you for listening, and I hope to listen to some questions. Thank you.
Thank you very much, Francis, for letting us know that proximity to demonstration gardens enhances data diversity through spillover effects. So our last speaker is joining us virtually, and this is Shalvari Patwadan. Shalvari is a research analyst from the International Food Policy Research Institute, IFPRI, and Shalvari will present on perceived constraints to healthy diet, and she will tell us about the evidence from agri-food assessments in rural South Asia. Tech people, please get us Shalvari online. Shalvari, welcome. You have 10 minutes.
Thank you. Hi everyone. I'm going to present a quantitative approach to analyzing the individual level drivers of diets in South Asia. So for context, challenges for healthy dietary choices in South Asia include constraints such as poverty, high prices relative to income, and availability and access issues. Perceptions of food can drive dietary intake. For instance, perceptions about affordability of food, availability, desirability, and convenience have been identified as key drivers of dietary intake. Yet there has been limited quantitative assessment of how individual perceptions of food relate to diet quality. Hence, our objective was to quantify the relationship between individuals' food perceptions and their diet quality across 5 districts in rural South Asia. Next slide, please. We use primary data collected for the Transforming Agri-Food Systems in South Asia, or the TAPSA initiative. Data were collected from 5 districts across 3 countries in 2023: Rajshahi and Rangpur in Bangladesh, Nalanda in India, and Bankura and Suket in Nepal. The total sample size was 4,000 rural households, and respondents included adult females, adult males, and adolescents. The diet quality outcomes for our analysis were derived from the Global Diet Quality Score, or the GDQS application. The GDQS collected ingredient-level 24-hour dietary recall data, and quantities were estimated at the food group level. The metric consisted of 25 food groups, 16 healthy, 7 unhealthy, and 2 unhealthy when consumed in excess. These 2 food groups include red meat and high-fat dairy. The GDQS healthy score is calculated based on the consumption of healthy food groups, with a possible range of 0 to 32. A higher GDQS healthy score implies higher consumption of healthy food. The GDQS unhealthy score is calculated based on the consumption of unhealthy food groups, including the 2 food groups that are unhealthy when consumed in excessive amounts. The score has a possible range of 0 to 17. The difference here is that a higher GDQS unhealthy score implies lower consumption of unhealthy food. These figures show the mean GDQS healthy and unhealthy scores. Nepal had a higher mean GDQS healthy score compared to Bangladesh and India, which implies higher healthy food consumption in Nepal. India had the highest GDQS unhealthy score, followed by Nepal and Bangladesh, which implies lower unhealthy food consumption in India. For our predictor variable, primary data was collected on perceptions about individual level drivers of food choice. Respondents were requested to agree, disagree, or neither to 8 statements related to individual food choice drivers. The statements were posed for a predetermined list of 6 foods, which included dal, eggs, green leafy vegetables, banana, biscuits, and fried food. We mapped these statements to the domains in the food environment framework. For instance, the first statement in the table below, given my income, dash are not too expensive, was mapped to the affordability domain. Using the responses to food perception statements about healthy and unhealthy food, we ran a principal component analysis, or a PCA. This was done to understand which combinations of the food perceptions maximally explain the variance in the sample and capture the theoretically latent perceptions. We ran 2 PCA models, one with responses to statements for healthy food and the other one with responses to statements on unhealthy. Let's now try to understand how the results from the PCA were used to label the latent domains of food perception. So the first principal component here loaded on 3 indicators, that's perception of taste, nutrition, and family enjoyment. These were theoretically mapped to desirability, as we can see from the table, and hence we labeled this domain desirability. The second principal component was labeled availability and accessibility, as the components loaded on knowing a vendor and ease of acquisition. All the domains for the healthy and unhealthy food PCA were similarly labeled. The food perceptions derived from the PCA were examined against the outcome variables, GDQS healthy and GDQS unhealthy. The models controlled for gender, age, wealth, years of education, household size, food insecurity, and included district 65. The OLS estimate for GDQS healthy score by perception of healthy food has been displayed in this figure. The x-axis displays the GDQS healthy score, while the y-axis displays the latent perceptions of healthy food derived from the PCA. Here, a higher score implies higher healthy food consumption. The orange circle represents estimates for Bangladesh, the red line for India, and the purple square represents Nepal. A separate regression model is estimated for each country. Controlling for covariance, perceptions of greater affordability, accessibility, convenience, and desirability of healthy food were significantly associated with higher healthy food consumption. In Bangladesh and India, multiple perceptions were associated with higher diet quality. However, in Nepal, only greater physical desirability was significantly associated with higher healthy food consumption. This figure displays the OLS estimate for GQS unhealthy score by perception of unhealthy food. Here, the GQS unhealthy score implies the score is lower, it implies higher consumption of unhealthy food. Perceptions of greater availability, accessibility, and desirability of unhealthy foods were significantly associated with higher unhealthy food consumption. In Bangladesh, only greater perceived availability and accessibility were associated with higher unhealthy food consumption. In India, all the highlighted perceptions were associated with lower diet quality, that's higher unhealthy food consumption, and in Nepal, only greater perceived desirability significantly predicted higher unhealthy food consumption. Our analysis contributes to the SPICE literature that measures perceptions of food in a quantitative manner. Our analysis also quantitatively links perceptions to diet outcomes. However, causal relations are defined from the cross-sectional data. From the results, we can see two types of desirability were identified: desirability for healthy food and desirability for unhealthy. Drivers of consumption differ by food and context. This understanding can help develop strategies to reduce unhealthy food consumption for different segments. Our analysis provides an insight into why individuals eat what they eat. And understanding these perceptions of food that drive choice may aid interventions for improving healthfulness of diet. Thank you for listening.
Thank you very much, Shavari, for letting us know about the importance of measuring individual food perceptions. So can we have one huge clap for all our presenters, please? So now it's time for our Q&A session. So first of all, I'll call upon our presenters to come on the stage, please. Please come forward and take your seat. Shavari, please stay with us online for the Q&A session. Thank you. So from the floor, please, if you have any question, raise up your hand. We shall start there. Thank you.
Hi, thank you all for your presentations. My name is Mark. I'm with the University of Greenwich. My question is to, I forgot your name, sorry, the Arusha example.
That's Julia.
Julia. Just about the workshops at the end where there was evidence of lived experience shared with decision makers. I wonder if you could speak to how that evidence was received, and was that lived experience evidence accompanied by any other form of maybe quantitative evidence?
Thank you.
Thank you. My question is for Augustine. So you mentioned you use the 24 hours period data, and then you're more focusing about the adolescents. So how you are capturing seasonalities? Because maybe if this data is like festive season, or like end of month, or at the beginning of the month, for the last 24 hours, maybe data may be misleading to understand like what types of food they are consuming for the last 24 hours. Thank you.
Thank you. Yes, please.
Good afternoon. Thank you for presentations. My question is also directed to Augustine. I just wanted to check, because some of the influencers for food choices could be parents, because we're looking at adolescents. And quite often, parents would give children money to buy food in those wrong food environments that the other study described. At the same time, give them lunch boxes, healthy lunch boxes, together with the money to buy food. And I think that's where the problem is, personally. So I want to check, because they are young, 11 to 19, their food choices slightly
Please
influenced
go
by
direct to your question,
what the
please.
parents are deciding. So I want to check your experiences around that.
Thank you.
For nutritious and healthy diet. So I just wonder, based on your studies, what do you think, are the most interventions to create nutritious diet? But also in light of the panels that we have heard this morning around being surrounded by unhealthy food environments and foods that are unhealthy for us and in the way they are produced. Thank you.
Thank you very much. So who among you will help to answer that, because it was directed to all of you? Julia, thank you very much. Not now. Just take it. I'll give you time.
Thanks so much for your interesting presentation. My question is for Francis. In your last slide, you went pretty quickly. You said 91% of adoption can be attributed to procreation. I think the idea of procreation is really interesting, But in your untreated communities, there was no intervention, or what's your comparator in the sense that the options that people selected, I would say, fall into options that a planned intervention might do. Poultry rearing, savings clubs, kitchen gardens. So did you have an option in that group where you had a planned intervention, being designed? Because I don't know how you got to your conclusion that this is evidence of co-creation being the driver.
Hi, I'm Ramya Ambikapati from the Alliance. I have a question for Kim Mason. I really enjoyed your presentation. It was really interesting. 4 out of 5 patterns were more on the less healthy side, and only 1 was the more healthier side. Seems like there's so many different ways you can be unhealthy in terms of dietary patterns. I would love for you to comment on that. And can you also comment on the types of food environment and the sort of daily lived experience that could have generated the kind of dietary patterns you see in the data? Thank you.
Thank you very much. So we shall first, I'll ask anyone who has a question for Shavari, a question for Shavari, please.
Hi, thank you to all of you for great presentations. Shavari, I was really struck by the differences between the different countries and the results, and I just was curious if you could speak to why you think there are such strong differences between the different countries in your survey.
Thank you very much. So I think this is the questions are enough for this first round. We shall allow our presenters to first respond, and if we have time at the end, we shall take some few more questions. So I'll give the floor to Julia first. You have 2 questions to answer. Welcome, Julia.
Sure, thanks. Thanks for the question, Mark, and especially because I ran out of time to talk about the workshops very much. I think, the workshops, we had some concern about how that second workshop would go when we were bringing together our research participants together with sort of a quite diverse stakeholder group, including policymakers and so on. And I'm not sure what to attribute the good dynamic that we had within that workshop too. I think part of it was the fact that our work was conducted with an existing platform where there was a certain level of, good understanding amongst those stakeholders. They had participated in various activities previously, kind of learning events, and I think there was a certain openness and receptivity within that group. The way in which we presented our findings was through this story map that we've created. So a way of sort of, stepping people through the research process, showing images of what we had done, images that had emerged from the photo voice work. And then in terms of those research participants, we had sort of a panel similar to this one, where we had a few vendors and a few consumers, and they had chosen their image that they wanted to talk about. So they'd had a chance to kind of prepare what they wanted to say. And I think the chance to kind of, be in a room with people, they had morning tea together and had a chance to sort of interact in an informal way, and then were able to speak to their experience of what's a challenge they face within their food environment, and also what's an opportunity they perceive within their food environment. So I think I don't know, I think photo voice is a really strong method, and I think earlier today we were hearing about participatory videography. So I think those types of lived experience methods where people have a chance to kind of, depict what their daily life looks like is a really strong kind of tool for change. In terms of the quantitative methods, I guess the timing of analysis was a bit tricky. We didn't have a whole lot ready to present at that workshop, but we were able to present some of the spatial findings around the distribution of vegetable outlets, fruit outlets, other food outlets within communities. And I guess, again, through a kind of a map on a screen shows sort of quite a striking image to see, I guess, especially the contrast between that rural location and the urban location, to really show from an access perspective what striking contrasts we see. To Fiorella's question about what drives demand, how we can shift demand, I guess I feel strongly about food environment research as this way that we can think about those contextual factors and how they interact with personal factors. So I think, the work that we've done has not been solely about demand creation, but as part of this end-to-end approach, we're sort of thinking through how can environmental changes shift the opportunities people have to be accessing fruits and vegetables, and also how can we motivate, so a bit similar to the kind of COMBI framework that we were hearing about earlier, sort of these multiple levers of change. So we're currently working through this human-centered design process where we're taking forward this food environment intervention prototype, which is around improved store design and hygiene trained vendors and branding of vendors, together with a number of changes on the consumer side, motivational messages, training in interesting recipes, counselling at a family level. So I guess it's this combination of factors as part of this end-to-end approach. Thanks.
Thank you very much. Thank you very much, Kim. Sorry, Julia. So the second floor I'll give to Augustine. You also have 2 questions. Kim has 1, so you can wait. Augustine, please go ahead and be as brief as possible. Thank you.
Okay, thank you for the question. And regarding the seasonality, the survey was conducted from December 23 to February 22 to February 23. So there are not that much time frame, only 3 months. So there is not that problem with within the data. So yeah, it's always a concern, the seasonality effect, but in this case, it wasn't a big problem because of the short time frame. And the other question?
I wanted his reflection on the fact that sometimes food choices are not only decisions that are taken by the adolescent children, but also parents influencing it through the money they give them to go to school, when they go to school, for example, irrespective of the fact that they would have given them healthy lunch boxes.
Yeah, that's true. And that's why in the model we included the different measures regarding, for example, the social norms from the peers, from the family, and also the permissiveness, how they can manage their own decisions, the agency. So it's important for the model to see how they are able to choose their foods. But yes, that's true, and that's why it is important to create programs at food level, at different levels that help children to choose healthier choices.
Thank you very much. I hope that answers the question. And now I'll give the floor to Kim. Please go ahead.
Yes, thank you for your question. What you said was really correct, that each diet, like there is a wide range of unhealthy and healthy dietary patterns, and they were unhealthy for different reasons. And I think in a way that's sort of the advantage of this method, by not looking at a diet quality index that gives one number for an individual, but that one number can be, for example, if it's a low diet quality score, it can mean either low intake of some of the food groups or low intake of others of the food groups. So in a way, with this method, you're really clustering by food groups, so you can get a bit more detail into why a dietary pattern is unhealthy. So in a way, I think that's the advantage of doing it this way. other than looking at a diet quality index. And your question about the food environment indicators, within the SHIFT initiative, we've also collected lots of food environment indicators, as Gabi already showed in her poster, so perceived food environment and actual food environment at the outlet. So we have all of that data. We're now trying to look at whether there might be drivers in the food environment that it can explain these dietary patterns. But that's a good point. And maybe to add to the seasonality, because that's also the data that I used, we'd only collected one 24-hour recall in that time period. So it didn't capture seasonality over the year. But I think, it's very expensive and difficult to collect a 24-hour recall. So multiple is not always feasible throughout the year. And in a way, it's quite a urban setting. It was a rural town to an urban setting. So there might be less seasonality than really rural areas. But of course, that's still, important to consider that that's not taken into account.
Thank you very much. Now I'll give time to Francis. Please go ahead.
Thank you. So the question is about what happened in the other community, in the comparison communities. And in the context of our project, we specifically did not approach the comparison communities to do any sort of intervention in terms of co-creation. But then in designing the project and to ensure that the benefits can also reach these communities even after we are done with the experimental phase, is that we have integrated all kinds of participants in these co-creation workshops. And for example, we are working with extension officers who are people who are both responsible for communities in the intervention areas as well as also in the comparison communities. We are working with the government officers just to make sure that every detail of knowledge that we gain is also can also be shared and can also reach these other communities. Working with the NGOs, especially in implementing all these programs, because then a lot of programs, of course, are going on in Turkana, and Turkana is one of the counties in Kenya with so many NGOs doing this kind of interventions already. Only that conscious kind of decision to make the co-creation and bring in the voices of the communities is what is lacking. So bring all these people together while not during within the time period of not necessarily to do the co-creation exercise in the comparison communities, we believe that then this same information and the impact that we have created together with these players can then be shared amongst the communities far and beyond the intervention communities. So I also wanted to add a little bit on the question on demand creation, and say that for our case, I think the co-creation approach in itself creates the demand for these healthy foods. And it goes beyond just the demand creation, and in fact brings in part of the interventions, part of the healthy interventions that we are looking at. We see like in communities like in Turkana, which the problem is not necessarily that they have these healthy food choices. The problem might be just they do not have so many choices to make. And so you have to consciously make the communities recognize that even limited within this context, they can still get healthy food choices to make. And so we can see that the communities are selecting, for example, to implement kitchen gardens, to come up with the village savings and learnings, and to do some poultry farming just to supplement the usual maize-based diets that they have. Thank you.
Thank you, Francis. Thank you very much, Francis. So we have Shavari. I hope you're still with us.
Yes.
Shavari, you have one question. Can you go ahead, please, and answer?
Yes. Thank you so much for your question. It's a really important one. I'll start with an example. So from our analysis in both the models with the healthy and unhealthy foods, we see that for Nepal, desirability comes up as sort of the main food perception that's driving food consumption. What I think would be a plausible explanation is that the districts in Nepal had slightly different terrains than the districts in Bangladesh and in India. So when I think about it, I feel there were, say, more access barriers to acquiring different foods. So maybe when you have to go a certain way to get the foods that you want, desirability is something that's driving you more. However, there were other differences in perceptions as well. For instance, I didn't have the time to show this in my slides, but we found that respondents from Bangladesh, there was like a higher percentage which perceived all the foods to be more affordable compared to respondents from India and Nepal. And we don't exactly know why. So what we do highlight is that there is a difference, and we look at what do people think and how that impacts their food consumption. Unfortunately, we don't look at why are people thinking that way. So there's definitely like a huge scope for researchers to examine that. So thank you so much for highlighting that.
Thank you very much, Shavari. So we are almost winding up, but I'll allow one burning question. Who has the mic? You have one. I saw your desire to ask a question. Please go ahead.
Thank you. Maybe because of keeping the mic for the team. Catherine is my name. And my question is to the team from Vietnam. And I wanted to understand the environment of the adolescents that you interviewed, thinking about a country like Vietnam. A lot of adolescents are in boarding schools, which is already a controlled environment. So just that description around, did you have some that were in controlled environments or they were all coming from home? I think the other question I had was for Francis. What I saw from the resilience is at baseline you had 91%, the kitchen gardens, but at the end, 2 years later, at 35. So basically 2/3 of your population disappeared within 2 years. And I was wondering then what resilience is in your context. And of course, knowing the environment where you are working in, what is this that you are also growing in the demo farms? Because if it's short-term crops, then there's already seasonality around that.
Thank you very much. So I'll give the 1 minute to the team from Vietnam who is going to respond. Kim, please, 1 minute, please.
Yes, I'll keep it short. Thank you for your question. The way we selected the adolescents was, as we said, that they were from peri-urban and urban Hanoi and a rural town in a rural area that was called Moc Chau. And as far as I know, I think none of the adolescents were living in boarding schools. They were all living at home. And we selected adolescents that were living and going to school in the same commune in order to be able to really map their home food environment and their school food environment. But as far as I know, all of them lived at home and not at a boarding school at this stage of schooling in Vietnam. So that's a bit of the description. And we selected them from lower and middle income communes. So that's also a purpose sampling that we applied.
Thank you very much, Kim. So Francis, if you can talk in 30 minutes, please, to respond. 30 seconds, please. I meant 30 seconds, please. Be very brief.
So thank you. Thank you for the question. So yeah, you are right that at the start of the experiment, we have 91% of the people implementing kitchen gardens, for example, but then somewhere along the extreme drought following almost 5 failed rainfall seasons, then we have that number reduced to 35%. And still, if you compare that to the baseline that we had only 8%, which I did not show 8% of people having kitchen gardens, there is some level of people maintaining the kitchen gardens. But that's what is important is that then we see that in impacting on the diet. that the diet was not necessarily just depending directly from the kitchen gardens. There are other social networks that were created. There are other basic family structures that were created that then were able to bring the communities back to normalcy, even during the extreme drought, that they're able to still feed their children on a diverse diet, and women are still able to consume diverse diets compared to other members of the community. And this is what we use then to define the resilience we are talking about here.
Thank you. Thank you very much. I appreciate all our presenters and participants for this insightful session. So few takeaways from this session. We can now say from all these discussions that creating demand is not something that we need to create the demand and not something that we can impose. We have to create it, especially that for healthy diet. So as we continue our efforts towards food system transformation, let us remember that demand is not something we impose. That is the main message. We have to create it. So thank you very much once again, and let us keep pushing the boundaries of how we define and shape nutritious and sustainable food diets. So a big clap for all of us presenters and participants. Thank you very much.